This short video on chapter 1 is going to cover some really key foundational concepts that you will see play out in numerous systems of the human body. I'm going to try to keep this short and really hone in on what I feel is material that will play out in your future and your future careers and clinical outcomes. So first of all, we need to define homeostasis, make sure that that definition is clear, and then we'll look at both how negative as well as positive feedback loops work to regulate or maintain homeostasis. Then we'll take a look at the cavities of the body, and describe how they're divided, what organs are going to be found in each of these. And then lastly, we'll look at the different serous membranes of the body. A serous membrane is just a double layered membrane, but they're very unique in certain cavities. And so we'll take a look at the role of those serous membranes. First off, homeostasis. So here you want to think about maintaining stable internal conditions regardless of what's going on in the external environment. And I would encourage you to pause the video and think about how many functions in the body we work to regulate via homeostasis. So you could think of pH, you could think of temperature, you could think of calcium regulation, sodium regulation, potassium, any of the ions we're going to regulate. Blood pressure is certainly regulated via homeostasis. Anytime you hear that word, you really want to think about a set point. So setting a thermostat in the house is a great example, right? And you see negative feedback come in. If it's cold outside and you have the temperature set to 72, then the heater will kick on to bring the temperature back up should it fall, and vice versa with the air conditioning in the summer. So it is the case that if homeostasis is disturbed, that is, if a physiological system goes outside of a particular range, a physiological range, then disease or illness will result. And that could be acute, it could be chronic. It really depends on what it is that you're looking at. So one of the primary ways that we regulate homeostasis in the human body is through negative feedback. So this is a situation where the response to a stimulus reduces or shuts off the original stimulus. So the variable is going to change in the opposite direction of the initial stimulus. I like the phrasing that I used there. So if this is homeostasis, right? Our textbook uses the scale in many different systems to illustrate if we fall either too high or too low, above or below homeostasis. So a change has to be detected first, and that's going to be picked up by a receptor. Let's say your blood pressure increases. You've got baroreceptors that would pick up on that. Afferent pathways will send that message to the control center, which is almost always the brain. And then from there, you're going to have efferent pathways that are going to respond to that change and bring it back to normal. And again, I'm going to give lots of examples here, but I wanted to just lay the groundwork. So there's an imbalance, receptors pick up on the change, that change is communicated to the brain, and then some sort of effect is going to be implemented. This is usually going to be through acting on the nervous system, acting on glands, acting on smooth muscle. But whatever that effect is, it is going to reverse that initial stimulus to get things back in balance. I like this definition too. Homeostasis does not involve keeping conditions static, right? We're not talking about keeping heart rate at 60 beats per minute all the time, right? We know that when we're resting, heart rate falls, and it should. When we're exercising, heart rate increases, and it should. But nevertheless, there is a low point, right? Our resting heart rate and really a high point, our max heart rate. And so within that range, you have a healthy homeostatic condition. But it's outside of that you can see disease manifest. So a classic example that is one that we can all relate to is just looking at thermoregulation. So here would be normal body temperature. If our body temperature rises, as we're outside on a hot day, we have receptors in the body that are temperature sensitive receptors in the skin and in the brain that are going to send signals to the control centers, the thermoregulatory center in the brain. Efferent pathways will then be stimulated. And in this case, if you're overheating, one of the effectors are sweat glands, right? So sweat glands would allow for increased evaporation, increased cooling of the skin. Another effect that we see on a hot day is we see distribution or redistribution of the blood supply. So you see shunting of the blood to the surface. You may have vessels swell in your lower arms to help conduct heat. So a little bit of heat loss through conduction. If temperature falls, you see the same pattern play out just in the opposite direction. So receptors in the skin that are going to be sensitive to changes in temperature will send signals to the brain via afferent pathways. We'll look at these terms again later. So afferent approaches the brain, efferent exits the brain. So efferent pathways. So in this case, maybe you see skeletal muscle and you see shivering take place. You would also see blood shunted away from the skin surface. That's one of the reasons that extremities like the ears and the nose and the fingers are more susceptible to frostbite on a cold day, because all that blood is shunted towards your core to try to keep your heart, your lungs, all those core critical organs warm. Another example, right, just to really get you thinking about homeostasis and how prevalent it is in the body, blood sugar. So let's say that before sitting down to this riveting video, you had a Starbucks Frappuccino, and as a consequence, your blood sugar shot up. So what you would see, and don't memorize the ins and outs of this. This is content that you will get to if you take 202 and cover the endocrine system. But just to see the patterns, right? So blood glucose levels will rise. And what will happen as a consequence is your pancreas will secrete insulin. And that allows for the sugar to be taken up into cells of the body. A lot of it's going to be converted from glucose to glycogen. We will see that come up shortly. And as a result, blood glucose levels fall. If blood glucose levels drop, let's say it's afternoon and you skipped breakfast this morning, you're going to have low blood sugar levels. And the way the body works to maintain your glucose is we release a hormone from the pancreas, in this case glucagon. We break down the glycogen, blood glucose levels go back to normal. So there are an infinite number of examples, it seems, in the human body of negative feedback. Again, it's definitely the most prevalent response or the most prevalent method through which the body works to regulate a particular condition or variable. With positive feedback, you're going to see that the response enhances or exaggerates whatever that initial stimulus is. You don't see this as often in the body. You usually see it in events that are infrequent and potentially dangerous. Childbirth is a classic example, right? Where you have oxytocin and you have prostaglandins working to dilate the cervix. And as the cervix dilates, it kicks back to the pituitary and causes more oxytocin and more prostaglandins ultimately to be released. And that cycle goes and goes until you deliver a baby. In the case of blood clotting, that's what's illustrated here. So as you can imagine, for a small vessel, not a big deal, but for a larger vessel, an artery, etc., you definitely need to clot that quickly. So if there's a break or tear that occurs in the blood vessel wall, platelets that are circulating through your bloodstream will actually stick to the side of that vessel. And when they do so, they will actually attract more platelets. And as those platelets adhere to one another, you're going to ultimately have that rip or tear sealed. So shifting a bit now to look at the major body cavities. So just looking at the color scheme first. So I'm going to go from the broadest cavity down to the smallest, and I've got other graphics of these as well. So everything that's shown in yellow is showing the dorsal body cavity. So it is going to include the cranial cavity as well as the vertebral cavity. With the ventral body cavity, that's everything that you're seeing in red. So it includes the thoracic cavity, it includes the abdominal cavity, it includes the pelvic cavity. And just to pause here for a moment, we talk about the cavities in the body, but perhaps the more important point here is, why do we have these cavities? And there's a number of reasons. So one, for protection, to allow for expansion. And as we'll see in a moment, many of these cavities are lined with serous membranes that reduce friction. So around the heart, for example, right? The heart is working so hard, and that if you didn't have the serous membrane around it, that would be increased frictional forces that the heart would have to work against. Same thing with the lungs. So in some cases, these cavities allow for increased movement. Think about something like the bladder expanding after drinking a lot of fluid, right? They allow for that expansion. Your stomach expanding after a big meal, your uterus expanding and blowing out these cavities during the third trimester of pregnancy. Lots of fun examples here, but those are some of the key reasons that we have cavities, again, for protection, to allow for expansion, and in some cases to reduce friction. So cranial cavity is going to include the brain, right? So that's the skull that is protecting the brain. Vertebral cavity contains the spinal cord. Thoracic cavity. So I'm going to show it from the sagittal view first. So here you have both the heart as well as the lungs. Now, looking at this anterior view, you can now see that there are, in fact, two separate cavities for the lungs. So there are two pleural cavities, again, for protection. If you rupture one of those cavities, then you have another lung that's still functioning. So the ability of the lungs to expand and recoil is incredibly dependent on pressure differentials between the cavity and inside the lungs, and also outside the atmosphere. So if this is punctured, that lung can collapse. So really important that we can maintain the cavities around those lungs. So the name of the cavity, again given to those around the lungs, is the pleural cavity. The one that surrounds the heart is pericardial. Peri is one of those root words that you will see an awful lot in this class, and I always think about a periscope. So a periscope comes out of the submarine and looks around. So peri means around, and so it's literally saying the cavity that goes around the heart. Coming back over here, the thoracic cavity and the abdominal cavity, the key divide between those two cavities is the diaphragm. And it really butts right up against the lungs, and it's going to play an important role in breathing as well. The abdominal cavity contains all of the digestive viscera. So your stomach, your liver, your small intestine, your large intestine. The pelvic cavity, so you've got your bladder, you've got ovaries, you've got testes, and you have the rectum. Here you have a great picture of that mediastinum. So this is anterior, this is posterior, right lung, left lung. So it would be like we're looking from the patient's feet, which is a standard practice when you have a transverse cut like this. So transverse cut, sagittal cut, just to start using that terminology to look at the planes of the body. And again, the mediastinum is going to sit between the lungs and posterior to the heart. You could also say anterior to the spinal cord. So this yellow space here. So with serous membranes, so first of all, a membrane itself is defined as a soft, thin, pliable layer of tissue. With a serous membrane, or we can lump that and say serosa, here you're dealing with a double layered membrane. And I want to use the heart first, the pericardial membrane, to first define this here, because I love this analogy. So if you imagine driving your fist into a gently inflated balloon, that is a perfect analogy for what these serous membranes look like. So imagine our balloon. So you're going to end up with one layer of the balloon that sits right up against your hand. You're going to have the air pocket, which in the case of our serous membranes is going to be filled with fluid to help with lubrication, to help reduce friction. And then you're going to have that other layer of the balloon that's going to sit further away. So we can take that analogy and apply the terms visceral and parietal. So anytime you hear the word visceral, you're dealing with the layer of that membrane that is closest to the organ. So if we're talking about the heart, we call this the visceral pericardium. If we're talking about the lungs, you're going to see that we have the visceral pleura and the parietal pleura. The pericardial cavity is the name of the space where the air would be in our balloon, where the fluids would be. And then that layer of the balloon furthest away from the organ is the parietal pericardium. So again, what we see is that these terms parietal and visceral play out with all the serous membranes that we're about to look at. So parietal, think internal body cavity and walls. Visceral, think right up against the internal organ. If you have a visceral reaction to something, it's news that upsets you, that kind of hits you in the gut, that disturbs you, right? So that's where that word comes from. Visceral refers to the organs, and so the visceral layer covers the organ. So here's some more graphics to go with what I was saying. So here's our heart. You have the visceral pericardium. You have the parietal pericardium. So around the lung, we have the pleural cavity. There's that word. And so that's the space that's going to be fluid filled. And to break that up, the two layers are going to be the visceral pleura right up against the lungs. So it's almost like saran wrap along the lungs. And then you have the parietal pleura, which is just that layer just outside of it, closest to the cavity of the body. So everything in yellow here is representing this peritoneal cavity. It is definitely out of proportion here, but it's just exaggerated to give you a sense for how this is divided. So once again, so it's peritoneal cavity, and then we're going to apply the words parietal and visceral to that. So the visceral peritoneum is going to be the one that layers everything in blue here. It's going to be the one that wraps right up against the organs. And then the parietal peritoneum is going to be the layer that is up against the cavity wall of the body. So it's all of this. As we get further into the course, you will start to hear references to organs that sit retroperitoneal. The kidneys are a great example of a retroperitoneal organ. Retro means behind, right? Retro clothes are clothes that go for previous decades, right? So retro just means behind. And so these are any organs that actually come behind this double layered membrane. And so to recap, we've seen three major places where you have a serous or double layered membrane. We have the peritoneum with the parietal peritoneum, visceral peritoneum. We have the pericardial cavity with the visceral pericardium and the parietal pericardium. And then we have the pleural cavity surrounding the lungs with the visceral pleura and the parietal pleura. So you're just applying these terms to each of those unique cavities. That is all that I have for this little mini lecture on chapter 1. So hopefully looking back over these key learning objectives, you'd feel comfortable answering any of these and explaining it to somebody else. Thanks.